Here we go. PT Breakfast Club is back. March 27th. I don't even know what day of the week it is. So I got to fill you guys in. So you heard me Tuesday. I guess today's Thursday. My wife comes back to work after 14 years of being on the sidelines, being in the back. She was doing like payroll. She would do accounts receivable. She was not accounts receivable, accounts payable, and all this other stuff. Right.
Right.
She comes back on Monday. The visits have doubled on the week. I'm like, what are you doing? What are you doing? She was like, okay, it's really complicated. When a referral comes in, I call them and book them on the schedule. That's all she's doing. But it's like, oh man.
So you have not been doing that.
No, I only call the ones I want to call. Half the ones I don't call. I don't check voicemail. I don't call people back. Like,
oh my Lord.
You guys have been on with me. Like, people will come into my physical clinic to schedule because I don't call them back. Now we have somebody who's calling them back, and imagine that our visits have doubled on the week. Which I'm like, you know what? That's fine. Put them on the schedule. I will see them. This comes to a couple of conversations I want to hit on today. Dave shared a post. We can start with that. That's a carryover from what we talked about Tuesday with MPPR. I got into an interesting, I cannot believe the spiciest conversations I've been getting into are on LinkedIn. Nobody on Facebook, on TikTok, on any of the other socials, like fight me on stuff. But on LinkedIn, I've gotten more like fighting kind of responses. We can talk about that, and I've got a little article to share. But you want to start with the screenshot, Dave?
Start with Dave's, yeah.
Sure, yeah. So this is one of our physical therapy colleagues, Kira. I think she's in like North Carolina or South Carolina. I can't recall which state, but she's not. I don't think she's in Michigan. Maybe she is, because she was saying she doesn't like this.
Jacksonville, North Carolina.
Okay, Jackson. Oh, there's a Jacksonville there. All right. So the reason why I'm always interested in what she's posting is she's posting something that is in a response to these cuts. Like, this is about Michigan and Blue Cross Blue Shield cuts in Michigan. But I'm always interested in what she's posting because she is adding has made a second business basically with like medical spa type stuff, like, contouring, like a contour machine and some other, self-pay services. And I'd love to, maybe we should have her on in the future because I think there's going to be a bunch of like cross referral, cross promotion. And she is going into this whole like medical spa world or semi-medical spa world with some of these self-pay services. And I always love what she's posting. What do you guys think about either this post, or I don't know if you guys know anything about her or what she's been posting?
Well, let's get into it. Let's give people the audio version. Kira says PT industry continues to be devalued and is in crisis. Reimbursement hits just keep coming. 17% payment cut for PT reimbursement from BCBS Michigan going into effect April 1. She hates it for her Michigan colleagues. PT often helps avoid more expensive, complicated medical interventions. I mean, the math isn't even that. It's not a stretch. It's right there. Things like surgeries, injections, opioids. Bad enough that our industry has been crippled with almost 30% cut from Medicare and federal payers over the last several years, while the operational costs and administrative burdens on therapists and clinics continue to rise. She saw a comment posted by fellow colleague Scott Gardner, and it's perfectly captured in the sentiment that of many of us that we've dedicated our lives to a career profession we love. Quote, we're not burned out because we don't love our work. We're burning out because we're being forced to deliver high quality care in a system that no longer pays for it. So I think we're going to talk about the quote and the idea and the feelings behind it. We're always talking about feeling. We're very feeling oriented here.
You know what? That blows me away. I never realized coming into this profession back in like the early 2000s, how like feely and left leaning politically and all of this stuff. I was completely shocked. I
flash people who watch the live stream know I flash this graphic all the time. You guys are sick of it. No, everything comes down to this.
Totally sick of it. Totally sick of it.
It comes down to this. If whatever you're providing, if it's not on that pyramid, right, then you're not providing it. And if it's not there, that's where burnout comes from. So let's dig into this.
All right. So for context, the 17% cut that they're referencing, that is Blue Cross Blue Shield, Anthem in Michigan is applying the multiple payment procedure reduction. That just means that if you're going to do more than a single CPT code in a treatment, they're going to reduce every additional CPT code after the first single highest relative value CPT code. So for an example, you do an evaluation, you bill an evaluation CPT code and 3 treatment CPT codes. The eval is the highest relative value. You get paid the full allowed amount. Everything else gets reduced. And it doesn't matter whether you're doing different CPT codes or the same. If I do 4 units of exercise in a session, I get paid the full relative value on number 1. Everything else gets reduced. So their calculations is about 17%. On Medicare, Medicare's done this for years. It's closer to 24%. And that's not a reduction on the fee schedule. That's just the fact that they're cleaning up how they're paying therapists for services because they've already paid for the facility fee and the overhead and stuff like that in the first CPT code. What caught my eye about that, I'm going to put it back up there, is the burnout statement.
Yeah.
We're not burned out because we don't love our work. True. Like therapists love what they do generally. We're burning out because we're being forced. Forced is where I have a problem. Clearly.
I know.
Forced to deliver high quality care in a system that no longer pays for it. So first, what the heck is high quality care? I could get 100 patients through the door. I could deliver non-scientific care. I could give them the most basic modalities and they would be so happy. They would love it because we have a great team. We have good personalities. We're going to joke and have fun. Like, is that not quality care? Even if they never got better, they're still going to love coming because they have a great time. Is that not quality care? And then nobody's forced. You are not forced to do this. We have more than enough examples of therapists who have left the insurance system, gone to self-pay, gone to other things, developed products and programs and other things. Nobody is forcing you to do something for less than you want to do it. It is just you want to stay in a failing system. Yeah. You want to use a business model from the 80s that doesn't apply to 2025. What do you think, Dave?
I agree. I love your approach, but it's fascinating that you are okay with it in that actual payment model. I think it's interesting. Like,
wait, who's okay with what?
Like Tony is saying, like, hey, it's okay if you if we were at APTA, if we were at PPS, if we were at some APTA conference, whatever, everyone would get mad at Tony right now if they're watching or listening. Any in-network practice owner is like, Tony, how can you say it's okay? How can you defend this? They're eroding our business model. They're eroding our profits, whatever. And I know we always talk about like, well, you got to think differently. Like Hira, they're doing out-of-pocket stuff. They're doing self-pay stuff. They're going to offer different services that are self-pay. They're not medically necessary. They're not covered, and they're out of pocket. And Tony needs to answer the phone.
I think I want to answer for Tony because Tony's going to answer the phone right now because his wife just sent another batch of emails or phone calls and he's got 38 patients showing up. I like that Dave used the term eroded because I think that's true, but also like that's what happens to rivers. Like the beach gets eroded and things move around in different directions. I think Tony it would be the first person to say, like, when something happens, be water, which is what I said on Tuesday, right? Be more like Bruce Lee, which is, this is how it's going to be. We can scream at the clouds all we want. It's not going to change it. I think it sucks. Tony thinks it sucks. I've got this rule when something bad happens, you can bitch about it for 24 hours. And then you got to put your boots back on and start doing something about it. Dude, it does suck. I mean, the profession I went into since I was 11, all I wanted to do was run radio stations. And I got to age 28 and I was running 2 radio stations. I was on the radio. I went to work in a Guns N' Roses t-shirt. And then this thing came out. And I knew time and space weren't going to matter anymore because the iPhone, I was able to listen to K-Rock LA while I was in Scranton, Pennsylvania, and things changed. The only constant is change. So you have to embrace it. I think the people that are least burned out are the most that absorb it and say, well, then how am I going to yes and this? They're applying those rules of improv to it. Dude, it does suck. Absolutely. I wish you could have gone into a profession when you were 22 years old and done the same thing and gotten really good at it and none of it changed for 25 years and retire. But we all know that ain't going to happen.
There was a live YouTube comment from Kendrick Taylor. Can you guys
Yeah,
put
yeah,
that back up?
yeah,
I know
yeah.
you flashed it on the screen for a second.
Oh, sorry.
Kendrick said Blue Cross Blue Shield has the most demanding patients.
What does that
And then
mean? Yeah.
I asked him on the in the live chat on YouTube uh if he can expand on that and what do you mean?
Do you see difficulty across like can you expect what a patient's going to be like, Tony, based on what insurance they have, or is that?
Yes.
Oh,
Yes.
really?
Yes.
Tell me more.
Oh, really? I was going to
Yeah,
say
yeah.
no. So okay, here we go.
Okay, so this is not a politically correct viewpoint, but we have to be reality. You know, we want to be a science-based profession, right? We want to base our decisions and our ideas on proven metrics. I can tell you right now, like there are third-party payers, I'm not going to mention which one, where they have higher cancellation rates, higher no-show rates, they have higher medical complications. It costs me more to deliver services, and these particular payer policies pay me less for more complicated cases. So, I mean, I think we see it we don't, but other therapists see it in pediatrics with Medicaid. We see it in all of these, scenarios. So once we moved and we separated from working with two spine surgeons, we virtually wiped out all of our Medicaid referrals. We wiped out all of our, non-post-operative back pain referrals. Our attendance rate shot through the roof. Our cancellation rate went to zero practically. So you can absolutely, just based on the payer, make educated guesses on what to expect on a population. You can never do it on an individual, because we would have individuals within that cohort that were amazing. They would come to everything. They would come 5 days in a row. They would crawl. They would walk to therapy from their house if they couldn't get transportation. But that represented a tiny sliver of that demographic. So yeah, you
So
can absolutely make those predictions from a payer source.
so I would never with the out of network insurance that we accept. So we accept Oxford, Cigna, Blue Cross Blue Shield, United Healthcare, Aetna, with like the top five, and including Blue Cross Blue Shield, like I just mentioned, on the out of network benefits side. Is he talking about like the EPO plans versus like the PPO plans, and like the EPO plans that are like you said, sometimes like the Medicare community based plans?
Well, that's the thing. We
Or
don't
I'm sorry,
know from
or the Medicaid plans.
we don't know from that comment if he's really talking about the patient being demanding, or if he's talking about the plan for the patient being problematic. I don't know. I don't have enough context. Dana's here. She said patients don't know what high value is, but I would say they know. It's just they have their own definition of it. Is high value feeling good? Because that could look very different for different people. But we know quality is relative to achieved, possibly outcomes. Value means cost versus quality. We can provide value when paid differently, not by volume. 100%, 100%. And that goes to Jerry Durham. So I shared a comment that I think plays in here yesterday, and I knew Jerry was going to come on. I said, being a professional means you can still deliver an amazing result, even if you don't like the job you are doing. Jimmy and I were talking about this before we started. I think therapists generally feel like they need to love being a therapist. They need to love patient care. They need to care about their patients, do everything about their patients, or they should get out of the profession. I've seen more than one therapist say that. If you don't love patient care, you should get out of the profession. I think if you're a professional, you can go out there and deliver an amazing patient care experience and not even love what you're doing. That's the definition to me of being a professional. Whether it's athletics, whether it's cleaning toilets, whether it's treating patients, you don't have to love what you're doing to be great at delivering the result and the experience that the client, the customer, the patient wants.
I just want to make sure I understand. You don't have to love every part of what you're doing, but you should.
I would say you don't need to love any of it. Being a professional means you're being paid to do a job. Go out there and do a job. That's it. You don't have to go to potlucks. You don't have to go out with friends. You don't have to wake up excited to do. You just go do the job. I think there's some value in that.
Agreed.
I agree. I think eventually people do this thing where they're like, am I going to want to is the juice versus squeeze good enough for me to want to do this for another year, 5 years, 10 years, 20 years? And that's when people start to say, oof, I don't know if I'm going to be doing this anymore. This has changed. Kendrick has a clarification for you, Dave. He said for them, meaning BCBS, to cut rates, they don't pay well. So there's the juice, but the squeeze still stays high because the patient wants a ton of extra. I put the juice versus squeeze in.
I don't remember when I was in the in-network therapy world, when I was in the different practices that took all the in-network payers. I don't remember this specifically. It has been my last W-2 job in an in-network practice was in 2015 or something. So I can't even speak on this. I would say I either disagree or I don't have enough information.
I think it's an interesting perspective because this goes back to the question of, patients don't necessarily, unless they're well trained and understand insurance, they don't even know what they're paying for. They don't know what's being paid for, So this goes to the question of, okay, if Jimmy and I are two consumers and Dave is going to be our in-network physical therapist. Jimmy is this executive. He's making $4 million a year. He wants the premium of the premium insurance coverage. He wants the gold package. He's going to pay, several $1,000s a month in insurance premiums, and he's going to expect everything. I'm going to look for the cheapest HMO that I can possibly find because that's all that I can afford. And I'm going to pay the lowest monthly premium. Now we come to Dave. Dave is going to get $55 reimbursement for my insurance policy. He's going to get $372 reimbursement for Jimmy's policy. Should Dave deliver the same exact experience for me as he delivers to Jimmy? I might have called you Jerry. So real question, like if you're getting paid $55 from my plan, $372 from Jimmy's, should you deliver the same experience? That's a question for Dave.
No.
Seems simple to me, but that's not what the patient's going to expect. That's not what other therapists in the comments are going to expect.
I know.
Dana sums it up here. If we accept third-party payer reimbursement, we accept how payers define quality.
Boom.
Boom. You signed a contract.
How the payer defines the quality.
This is what we've been talking about. I feel like we started to put better words to it, but we always knew this was understand who your customer is, right? That's what Tony had said. And that's what we started talking about a lot more on the show, which is you have to understand who your customer is. Dave's customer is different than Tony's customer because Dave's like, I'm staring the customer in the eye. Tony, have you ever stared the insurance company person in the eye? No, but you got a little piece of paper and you scribbled on it, probably digital signed it. And then you said that, and then you can go home the next day and you can complain about it, but you signed it. Dave has to negotiate that every day. And he looks him in the eye and he goes, happy, sad, are they good, right? As long as they're on good terms, they're happy. That contract is going well. Tony, how often do you renegotiate those things? Are they year, multi?
We haven't renegotiated an insurance contract.
That's not what I meant. Sorry. How long are they good for? How long are they a year contract? Are they multi-year? Like if you say I'm Blue Cross Blue Shield, how long is that?
I don't even know, truthfully. Like I would imagine they're different terms. I would imagine they're different terms. I really don't know. I mean, we've been in network with Blue Cross here in Ohio since 2006. I know we've been re-credentialed at times, but I don't know that the contract ever expires or anything like that. I really have no idea.
See, Dave figured this out. If the customer directly pays you, be sure you know how they define quality. Some want you there. I'm guessing, Dave, like I value quality as like I call Dave and he shows up, somebody shows up an hour later, or I feel good when they leave, and good is super subjective. So understand what game you're playing and who the referee or the umpire or the person in the box putting points on the board or deciding what an error is. Make sure it's home field advantage.
Like one quick example, I spoke to a new client on Tuesday. It was the daughter of a patient. The patient started yesterday on Wednesday. She said for her father, who had issues with being bedridden and now with transfers and moving around the apartment, all that, She said, we've had Medicare-based physical therapy. We're looking for something a little more involved, a little more this, that, and the other, right? So then I dug into like, so what did you not like about those things? Well, one thing she said was, um, the therapist would give us like really big time windows, like 2 or 3 or 4 hour time windows. Like we'll come within, almost like the cable guy. Like we'll
Cable
come
guy,
within like
come on.
we'll come within this within this 2 or 3 hour window, and then when they show up they're there for 15, 20, 30 minutes. So there was no, they weren't managing her expectations, or just, she's not even the patient, but she's kind of like co administrating like the care, or coordinating the care and the scheduling and all that. So what else do you not like? Well, the therapists were kind of cold. They would send random therapists. It was not always the same person. Okay. And then, so I'm trying to dig, I want to find out like, what are the pain points? Then when they would show up, they were very transactional. There was no rapport building. There was no relationship building, all that. Easy peasy, baby, because we supply all the things that she is looking for. So I said, it's always going to be the same therapist. We're going to tell you we'll be there around 10:30 a.m. It might be 5 or 10 or 15 minutes before or after that, but we're never going to say a 2 or 3 hour time window. And I know for sure the therapist that I'm sending, Horace Mehta, one of my best therapists, I said, he's met my wife, he's met my son, he's treated my back, he's excellent, he's got a great bedside manner. I know for sure they're going to love him when he goes there. Turns out they loved him. She was texting me right after the visit, and now Forrest is going to go treat her father 4 days a week, spending a lot of money per visit and per week on this, because they were looking for what else is out there. And in this case, something that the Medicare-based physical therapists in general can't offer or don't offer.
Yep. Scott has a great line there. It's all about setting expectations. I forget who it was. I think it might have been Chris Doe. And if you don't know who Chris Doe is, also known as the Future, it doesn't make any sense for a PT to follow him or listen to him, but it makes complete sense. And he had a great answer to an objection. He sat down to design a logo or something for someone, and they said, I don't think what you do is what we need. And Christo came right back and says, I'm not sure it is either. That's what this calls for. Like, he wasn't like pushing back, but of course you need what I do. I design logos and I can make you look great. Christo's like, he literally was just water. He's like, okay. He took that objection and was just like, yeah, I'm not sure either. I might not. And then the person immediately was like, leaned in and was like, but I want to find out. So this person was trying to put up a wall. That's setting good expectations. Like, I'm going to find out what you're looking for. That's what this discovery call is, or this 15 minutes was. It's about expectations. That's exactly what Dave did, which is like, what do you like? What does good look like to you? And if you don't know that, shame on you.
So talking about expectations real quick, it's funny how there can be a therapist that I disagree with on a lot of non-physical therapy topics, like patient care topics, but I agree. I love him as a therapist. So
who is this?
Jeff Moore.
Oh, you disagree? Okay. I thought we were talking about something different.
Nope.
Okay.
I disagree with Jeff Moore on a lot of things. But
like what? Like what? Like the one-on-one care?
Let's take a look at it. So
that's a lot of words. That's a lot of words. My eyes are gonna go Google.
Yeah. You don't have to read it. Well, I'll give you the gist of it. Basically, Jeff shared this post yesterday. This was shared with us from a fan of the pod, or a friend of the pod. That's what I was looking for. He basically is discounting telehealth. He's saying, my understanding, Dave, you might have a different perspective because you read this also. He's saying that, like, we see that telehealth is not what we wanted it to be, expected it to be, that patients still want hands-on care. They want the direct, connection with the therapist. They want, quote, a fully immersive experience. You need a space, but here's the rub. It will be your largest overhead expense after payroll. He's talking about rent. It's both getting worse year over year and completely out of your control. It's the last part I want to reflect on. He's basically saying, that we need to get back to hands-on, direct, face-to-face patient care. That was my understanding. Is that what you took from that?
Agreed. Yep.
Yeah.
Okay. But I disagree. I still disagree. Like, there's a population that wants that. I give you that 100%. But that just doesn't take into account the people who don't want that. The people who do want telehealth. The people who, I've talked to so many therapists that have gone 100% online, and their clients love it. The access is remarkable. They get to work with people all over the world, all over the country. They get great outcomes, great results. And I still go back to, confirmation bias. The people who are going that want the face-to-face human contact, those are the people who are going. So of course, every one of them wants that. The people who don't want that are not going for that. And so we don't get that shared perspective unless you go specifically to the telehealth therapist and you see how amazing that their business is running.
I feel like I'll go next because I feel like Dave's going to have a far different view. I sort of agree with Tony and Dave, so I should be.
No, you got to pick a side. You got to pick a side.
No, I'm going to be in the middle. I should wear a referee shirt every day. That should just be my everyday shirt. I'll just be in the middle.
I'm trying to be tame today also.
I feel like saying someone, because people they say, I'm a telehealth PT. I'm a virtual PT. I feel like that's saying I'm a cash PT, which is like how it's delivered or how
Medicare pays for telehealth.
Right. But like, to me, it's like, with my experience with my dad, if I had to go to his doctor's office every time I needed a question or a med change or something like that, that would be a real pain in the ass. This doesn't mean I never want to go and see my dad's doctor in person, because sometimes I'm like, she needs to see him right now. He's different. She needs to see and feel that. And sometimes my dad wants to go to the doctor because I feel like when he's watching me or watching a screen, it wasn't the same thing. Now, I know someone's screaming at their speakers right now going, but PT is different. It's very immersive. And I agree. I just don't think, we learn this from school, always and never. Those are tricks in questions, right? When you see always or never, all you have to think of, and this is what Tony's saying, is one exception. And then that is negated, and that can't be the answer. So I think it's great for what it's great at. I think it's horrible for what it's horrible at. So is it here to stay? Of course it is. Dave, you're up. Tee off.
I agree with Jeff Moore. I wish there's some survey. I wish there's some third-party survey, and maybe we'll get to it at some point. Maybe Larry Benz is working on it. Maybe Jeff Moore. I don't know. Someone. Tony, like, I think I've tried to press you before, and I said, how many telehealth visits how many have you done last week or last month? And I think previously, recently, you said 0. So
Yeah.
Do you guys ever have people calling in or emailing in or anything asking for video visits or telehealth or whatever verbiage we're talking about, a virtual consult?
You want to know the real answer? The real answer is yes, practically every day. Yesterday, we checked voicemail. There's multiple people from different states that are on there saying, I've got this question about my knee replacement. Now, full disclosure, right? I've got the big YouTube channel. I've got the Facebook. I've got lots of media out there. People are seeing it. People are consuming it and coming, and they want services. And they say, I will pay. I'm happy to pay whatever I need to do. I just need 15 minutes of your time. But that's the thing, right? So are those people saying, Tony, I want your magic hands, those magic fingers on my leg to make me feel amazing because nobody else makes me feel as amazing as you make me feel? No, that's not what they're looking for. But they will pay a premium rate to get a professional on the phone who's non-biased, who has no agenda, to give them an honest answer. This one particular call yesterday, he's dealing with an extensor lag. He did a bunch of research. He's trying to figure out if he's going to deal with this the rest of his life, or is there hope for him to regain the full extension? He wants 10 minutes. He's happy to pay whatever rate I want to charge him. I just don't want to do it. I go back to
that's fine. I don't want to sonic boom you guys, but you're talking about two different things, Tony.
We are.
You're talking about someone that's not even close to your office or in another state. They're looking for a one-off. They're looking to speak with you once, maybe twice. Telehealth, we're talking about 12 visits, 20 visits, whatever, right? Like when we're talking about in-person versus telehealth, we're talking about the full plan of care, not I want to speak to a professional that's on YouTube and has got a big following, and yeah, I'll pay any money out of pocket for one consult and whatever visit. But for telehealth, like, I think we're talking about, like in the Jeff Moore thing, folks to go through their full plan of care for a new issue, new injury, new ache or pain or whatever. Yes, I agree with you, Tony, on the premium onesies and twosies, the one-off calls with someone like you. But I agree more with Jeff. I agree mostly with Jeff Moore in regards to someone who's got a balance issue, an ACL, back pain, headaches, whatever it is. One-on-one in person, I believe, is better for that instead of the full experience to be virtual?
Yeah, I bought a house 3 years ago, and I owned a drill and a screwdriver. I've subsequently got more tools, and what I've realized is there's no one tool that does all of it. You got to have a garage full of tools. And some of these things are great for one thing and horrible for another, man. You try to open a paint can with the wrong tool, you're going to get paint all over the place. I've fallen for that trap.
So, Jimmy, you talked to Kristen. I think you might have done an interview. She is a PT or an OT, I can't remember, who's part of a company. They developed hardware, a hand device. Her entire practice is treating. Can you hear me?
I can't remember.
Okay.
I'm thinking. This is my
Well,
thinking.
anyway, her entire practice is treating patients who have had a stroke remotely using this technology that does stuff with their hands. I am a complete neuro idiot. I know nothing about neuro PT. But I mean, I interviewed her. I'm 99% sure you interviewed her. They've got an amazing company. They've raised funding. I think they've got this product out, and everything they do is online, and it's full plans of care to completion. It's a neuro-based population. I'm just saying there's plenty of evidence out there to support the effectiveness and the benefit of that kind of service. But that doesn't mean you have to do it.
No, not at all.
I'm not going to do it. Yeah. I think that's it. And I don't even know how to say it. Imago. I'm gonna go.
I'm gonna go over here.
It's brutal. It's brutal.
I'm
It's a
gonna
brutal
go in
name.
like 10 minutes.
I was on their website the other day. It was actually it looks like a good website because I think someone maybe who you're talking about posted
They have
something on
tons
LinkedIn
of
or something.
research. They have tons of research. I mean, it's an amazing backstory.
So Jimmy, you said recently. So your dad, he's tall. He's a big guy, ex-firefighter. He had a bunch of falls recently. I know he's not in your home anymore, but if he were in your home, how could virtual physical therapy help him?
That'd be the wrong tool.
Right.
But in between, like you could say, hey, Jimmy, who's not a PT but has his dad, can you walk me around your house? I can suggest 3 things you can do in your house. You could take away that rug. You could, put a rail in your bathroom. Like that would be a better tool. Like if you wanted to do like an in-house quickly, right? Someone coming and doing a home assessment would be better. But like in between now and then, like he could fall. So like, I think it's the right tool when it's right. And it's the wrong tool when it's wrong.
Tony, would Medicare pay for that?
So I with the extension to the budget and stuff like that, I need to find out if they also extended the coverage. Right, previously, telehealth was set to expire the 31st of March. I think it got extended. I need to double check before I say anything. Rick Gawanda has the answer. I don't have the answer right now. But yeah, I mean, if it's a covered service, Medicare will cover it. If you would see this patient in the clinic or in the patient's home, Medicare would cover it. Medicare would likely not cover the device and stuff related to the hardware, but Medicare would cover the service. And so I know that they're doing, great things. They're bringing on therapists constantly. They're growing the team. To me, it's a really inspiring story. Let's pivot real quick because I will have to get off in less than 10 minutes or so. I'm on LinkedIn, and there are two comments that I don't want to share the comments just because I didn't get clarification yet on if I understand what they're saying. One comment was from a physical they're both from therapists, but one was basically saying, I get the impression, and I'm trying to clarify, I get the impression that if I said something about, okay, so here's the context. I've got a patient, he's actually here right now. He wanted to quit therapy, quit completely.
Oh, yeah.
But he was like, he'd been coming 2 times a week. He's up to 36 visits on the episode of care. And he said, I was going to quit, but my wife wants me to keep coming. So let's go to 1 day a week. I was like, that's fine. It's a self-pay. We finished the insurance coverage. This is self-pay services. It's been self-pay services. Right. So I'm like, that's fine. And I thought it would be funny. I was like, hey, LinkedIn people, patients aren't always coming because they need to get better. Sometimes patients are coming just to stop the nagging. And so that turned into this whole thing that if it's going beyond a certain level, you shouldn't call it physical therapy anymore. You should call it wellness. You should call it personal training. I'm like, I'm not against that, but you know why? I thought the move was everything is physical therapy. You sneezed. Oh, we've got a physical therapy for that. You know, so I mean, what do you guys think? I think we're all on the same page. Like, I don't think we should be discharging patients. I think we're battling the decay of life. That was a comment that I made on it. We're always fighting the clock. We're always fighting time. I'm going to be weaker and sicker tomorrow if I don't actively do something to reduce that effect, the effect of decay.
Yeah.
What do you guys think?
Dave, you can go first because I got a particular thought or three.
I agree. I mean, do we keep calling it physical therapy for the most part? Yeah. I mean, we might, in our notes or I don't know, whatever, like describe like, all right, it went from like an episodic ache or pain, or that's how we got, connected with the patient. They achieved their goals. They got back to walking better, arm swing, whatever, if they had some neuro involvement. And if that's better, and they continue to book visits with us and it's self-pay, then my therapist and we do describe it as like wellness or maintenance. But would I go on LinkedIn and say like it has to be called wellness or maintenance and it's not physical therapy anymore? Yeah, I agree with Tony. It's still physical therapy. We still have our physical therapy brain that we're maintaining that client, their current status, but as soon as they have some trip or fall or new ache or pain or whatever, and we have to reassess or evaluate a new issue, which happens for some of our folks that are ongoing for months or years or whatever, some new orthopedic issue pops up on top of their neurological issue, and the physical therapy brain is still there. So then we evaluate the new episodic issue, we clear that over whatever amount of time, and then we continue with them on maintenance or tune-ups or wellness or whatever. But I agree, like overall, it's still a physical therapist coming to your home. So to me, yeah, it's still physical therapy.
Yeah, Tony's being too kind, and so I'll be
way too kind. Way too kind. Here we go.
I'll be the other end of the spectrum here. Was this is like, in my opinion, this is either AI or two people with a stick somewhere, and they needed it removed because they kept saying, what is the point of this? And like, I jokingly in the beginning was like, the point was that like, I just everything I did in the first couple comments was copying and pasting things that Tony said. It was like, he said feels better every time he leaves and it's cash pay. Isn't that the top of the pyramid? Like that's
where you want to be.
There's self-transcendence, right? There's self-transcendence. He's understanding how he rejoins society. Somebody then commented below like, well, his wife's making him go. And I'm like, I don't want to read too much into it, Tony, but that's what he said. But like, I don't, he kept showing up. I feel like there was no gun, right? There's no firearm present to force this person into going. And then later on in that thread, I was accused of being intoxicated while in school during ethics. To which
I thought that was a typo, but I kept reading it, and I don't know. I agree. Yeah.
To which because he's actually said, looks like someone was drinking during ethics. To which I responded, do you understand what libel means? And you should be careful about disparaging people, which might damage their image in public, because that's what libel is. That was probably in your ethics class. Here's the thing.
So these are two different comments from two different people. One person didn't like the idea of using the words physical therapy. My understanding was once we weren't rehabbing a specific injury or pathology, once we moved out past that, they wanted it called something else. The other person was saying it is fraud. And then he said everything, if I'm delivering counseling services, that's fraud because I'm not a counselor, I'm a physical therapist. Don't we counsel on what you should be doing, how you should be doing it, the stages of healing? Like that's counseling. It's not necessarily brain psychological counseling, but it's counseling. And then everything was fraud. If you do this, it's fraud. If you do that, it's fraud. It boiled down to he felt that I was keeping this person in the clinic, charging them money every single time just to take their money, which is kind of funny because, like, again, you can quit anytime. You can leave anytime. Nobody is ever forced to do anything. They're coming, like Jimmy said, because they see enough value in coming than value in not coming, whether that be keeping my wife happy, whether that be just, it feels good, rub my back. Oh yeah, I like it. Like whatever the value, there is value there perceived by the client, just like Dana and others have said here. He is deciding how he measures value. But yeah, these guys were just crazy about like their perspectives and their biases, which is fine. I think it's interesting because, obviously we tend to be, I think, a little more forward thinking. These guys are just hanging on to a model that I think died 20 years ago. It's not here anymore. So
white knuckling.
All right, Jerry is in the house. Jerry says people have such a hard time with your process. Okay, this is going to be my parting shot. I'm going to let you guys take over the last 15 minutes talking about hard time with a process. So remember, my wife has been out of the clinic for 15 years, 16, almost 17 years. She came in, she saw what I call an evaluation. She was like, what just happened? I was like, I just did my evaluation. She was like, what do you mean? I was like, what? This is an evaluation. She was like, that was not an evaluation. I was like, I got every required element within an evaluation. My evaluation is done. I can show you the policy and the guidelines of what is required for an evaluation. In 5 minutes standing at the desk, I finished my evaluation. That doesn't mean I'm never going to reevaluate. That doesn't mean I'm not going to get more information and more context and more history, but I don't need to do it all in the first meeting. I can get that stuff as we progress. And one more time, confirmation to me that what I'm doing, which a classically trained physical therapist who's an amazing physical therapist, much better than me, the fact that patients keep coming and they don't quit, they don't drop off, they don't end prematurely, that tells me that they value what I'm delivering. The fact that an insurance company can audit my accounts and approve everything that I've done tells me that the customer, the insurance company, values what I'm doing. So I'm satisfying everybody. I'm checking all the boxes. But when she saw what I would call an evaluation compared to what she remembers an evaluation to be, we are living in different times and very different worlds.
Well, I mean, you progressed, you changed, you can do more with less. So you're like, listen, what I used to do, it's superfluous. It doesn't need to be there. So you just do what you need to do to get the information that you think you need.
Yeah. All right, guys, I'm going to go because I think I got patients out there waiting on me. But you guys wrap up the show. Thank you as always. I'll see you guys next time.
Sounds good. All right, now that he's gone, here's the thing. He was being way too nice.
Way too nice.
Yeah, I think you want to go even deeper. And I'll make some assumptions, Dave, which it appears that those two guys at some point during their rage thread were making assumptions, which is like this is how it needs to be because this is how I do it. This is projection, in my opinion. 101. This is how I do it. Therefore, this is how everybody should do it. I got to be honest, this type of thinking is exactly one big thing that's wrong with our profession. It's actually wrong with a lot of professions, which is there are enough people watching this thread. Tony's got a big enough following on LinkedIn and people watch. And if they get nervous, they started throwing around an F word, fraud. Of course you wouldn't do that. But if you actually, I just kept referring to the original post. Everything I kept saying was there's a dude who was coming in through insurance benefits, who's now just reaching into his pocket and paying money. And when he leaves every time, he's super happy and feels good. And they have an issue with that. And I'm like, I'm going to need you to point to where the problem is. And I'm going to need you to explain it to me. And their response was, it's fraud. And you drank in class during ethics class. I'm like, all right, man, this sounds just so much like I don't like what you're doing. Therefore, you're wrong. That's a closed mind.
Tony not only is way too nice, but I mean, he posts a lot of clever and creative thoughts. He posts a lot of questions, and sometimes it's like this, scenarios of what is actually happening in his office, which is great for him to share. But yeah, he actually has maybe the best restraint of anyone that we know in our whole physical therapy online circle. He will not, reply sarcastically ever.
Yeah,
Dr. Bo checking in from Colorado, posting live here on the YouTube chat. He said, "Ignore the trolls." That's what Tony kind of does. I think he's great at that. You and I like to hit, reply, tag the person right away.
Well, I'm like in the beginning, Tony and I think both had playful responses, which was like my way anyway of saying like, read the original post again. Like, just FYI, I'm copying and pasting this from the thing you're commenting on. Like, did you mean to say that? And once he doubled down, I then tripled down. Like, I have no problem with it. I would also have those people come on the show and be able to verbally explain. I've done that before from people who've like gone after me in comments, keyboard cowboyed it. I've said, great, like come on the podcast and let's talk it out. Maybe this is a miscommunication. This isn't always the best way. Typing and text is a one-dimensional way. Let's figure out what you're actually talking about. It is opening day. Happy opening day for all that celebrate.
I had that pulled up on another browser tab right here. The Phillies are playing at the Nationals tonight, opening day. Your Yankees, who are they going to lose to today?
I don't know, but this just in, the Mets have been mathematically eliminated from the playoffs. Very unfortunate.
Yes,
so
we can
both troll on the Mets.
Yes.
Am I giving too much energy and credit to keyboard warriors? Here's what I like to do. I like to do it in public and just say, listen, I'm not going to put words in their mouth. I had great advice from a former boss in radio. If you hand someone enough microphone cable, they'll hang themselves with it. So if you keep feeding the troll like in public, I'm going to let that person sink their own argument, in my opinion. So I have no problem with it. Plus, we know how the algorithms work. Comments equal exposure, exposure equals exposure, and it's a snowball. So I get it. I mean, there's some people that I wouldn't give any air to. Mets finish in front of the Yankees. I don't know. In payroll, maybe. I mean, Soto's going to be the most expensive guy in Major League Baseball. Dave just checked out. He's like, no, I'm not talking about this anymore. Dave, you still there? Maybe. So that is my response in terms of giving credit and energy to keyboard warriors. Maybe it's too much. I ask questions. I tell us this is my superpower. I tell people all the time, if you want to sound funny, interesting at dinner parties, just ask questions. Don't answer them. So I just kept going back to the trolls and just saying like, well, is this what you mean? And they triple down with a soliloquy and they go deep and I go, all right, well, how about this? If you give them enough space, they'll hang themselves with it. That's my opinion.
Just got a call. And since I'm doing that live show on my phone, anytime a call comes in, I get bounced out.
Oh.
So that's
your
the explanation. Yeah. I missed the end of that, but yeah, I don't know. I just I think I love our approach of responding.
Yeah.
I don't. Also, another thing that we don't usually talk about, and maybe Tony can chime in on this in the future, but like when we're talking about these self-pay services or cash pay or whatever, like, and sometimes the dollar amounts or how long someone stays with us or whatever. I think sometimes when therapists from across the country or across the world, but definitely across the country, they see that online when they comment. I think there's also sometimes they're kind of like they wish they could have that, like they don't have it, like they wish they had
Maybe.
the ability, maybe live in a metro where they could charge whatever they want and have some folks invest a lot of money in their health and wellness through their therapy services, their wellness services, whatever, and they wish they really had it and they don't, and so they kind of sometimes lash out and they get jealous or whatever.
Yeah.
And then they'll say like that's inappropriate or that's not right or that's not physical therapy or whatever. Like just abnormal emotions come into the comment section because of it.
Finger wagging. You can't do that because I can't do that. I mean, this was a big contention with Fox Rehab. They were doing Medicare Part B in the home for 20 years. And the first couple of years, people were like, you can't do that because no one did it. But they were like, this book doesn't say it has to be provided in a clinic. The care has to be provided in a clinic. So they were like, you're committing fraud. Well, then we're committing fraud on a crazy scale because we keep asking and we've got smart people who know how to read the words. So yeah, people project. I don't like what you're doing, therefore it's wrong. Well, like wrong is really subjective too. Like what's wrong right here and wrong there is different. Also, people might feel icky. Like you might be part of the problem because you believe you've been in the system so long. You're like, it should be, everything should be covered. Everything should be free. Everything we provide, we should be able to be just like pour our heart out and it should be paid for by this insurance. It's your money. Like keep in mind, it's not the insurance company's money. It's your money, but you signed a contract as a person with care and as a provider that said this is covered and these things are not. If you want more and you deliver more like Tony's doing, you can reach into your pocket and pay for it. Just because you don't like asking for it, or you wouldn't want to do that, or make you feel icky, I'm very sorry, then you won't get that. You won't get it.
Have you ever, since we're talking about that specifically, have you ever heard Jerry? Am I muted? Am I good?
No, you're good.
Have you ever heard Jerry say, and Jerry just said, you guys nailed it, mostly Jimmy, because Jimmy was explaining. I love it.
I was doing this.
Have you ever heard Jerry Durham say, and I agree with him, how he says some of these like big corporates and mills, whatever, that they're just billing companies, like they're just all about billing units, and they're,
Well,
it's less about the patient experience and all that. So like we're the opposite, obviously. Like we like, we do an hour one-on-one visit, so of course it's like 4 units, but like there's no productivity around units and all that. Like we're
Right.
completely focused around the patient experience, because most of the time someone's paying out of pocket, or they have to pay out of pocket to hit their out-of-network deductible. Then we'll bill their out-of-network insurance. So for the most part, like someone starts with us and they're usually paying out of pocket way more, at least in the beginning, than an
Right.
in-network physical therapy experience.
Right.
But we have a different experience, and it's not for everyone, but it's fascinating. It's always funny when Jerry talks about like some of these big mills that are doing, 3, 4, 5, 6 patients per hour. And
Right.
he describes them as billing companies. Like they're just billing units. They're just running these units. They're sending out these claims, and that's the main focus. That is their business model.
Yeah. I mean, I had great advice. I'll give him credit. His name was John Crawford. John was the sales manager at the radio station. So a lot of times the sales manager, the guy with the suit, and the program director, the guy with the Guns N' Roses t-shirt and the microphone, a lot of times we're at odds. But he would bring me on sales calls, and he had this great line. I don't know if he made it up or not, or if he stole it from someone, but it was, understand the game you're playing. If I'm playing ice hockey, but you're judging me on figure skating, we're both wearing skates in that situation, but I'm playing the wrong game. So he'd have clients who are all about local, right? This is a local client. Their business is in our area of the radio station. They don't care about numbers. They understand that their kids and their employees and their customers think Jimmy's radio station is cool or not cool. And then you have national organizations like Toyota. They don't care who the hell Jimmy McKay is in Northeast Pennsylvania running a radio station. They just care about what your numbers were last quarter, and they're going to pay they're going to pay according to those ratings from last quarter. They're going to pay a percentage of that. So that is an example of what Dave does. Dave's like, I've got a homegrown business that's based in Scranton where the radio station is. I'm going on gut and heart, baby. Give me what I want. I want that radio station. Versus Toyota, who's making decisions from wherever the Toyota headquarters is in the U.S., they're just looking at what your Arbitron ratings were last quarter. We're going to pay on that. That's the insurance company. I've decided that this is worth that, and I'm going to pay it. I don't care how great you are. I don't care how great people in the community think you are. This is that. Versus what you can do if you're playing a different game, right? Make sure you're understanding. Are we figure skating or are we playing ice hockey? Because it matters, and you can be real pissed if you score 9 goals, but you didn't do any triple Lutzes and you got a 0.
Completely off topic. Did you run into Scott Gardner at that physical conference, that physical event?
We passed each other. Yeah, we said hi.
So I can't share because I'm on my phone right now, but on LinkedIn, there's a picture with Stephen Cohen from Sarah Health, RTM, with Scott Gardner. Did you see that blazer that he had? Like the UPTA blazer?
He's got a UPTA logoed blazer. Looked very sharp. I didn't.
Yeah.
It just looked like a loud blazer from far away, and then you got close and you were able to see it. But I can't believe what is Steven from Sarah Health wearing in that picture? Is it a green zip up?
Green zip up, yeah.
He has this Sarah Health outfit that looks like it could be made for Will Ferrell's character in Elf. It is hysterical. You see it from a mile away. You're like, It's a bold move, but he's the guy that can pull it off. So that is honestly, the blazer was good for the UPTA blazer. Steven from Sarah Health, because he also has pants with it too. And the pants are, and Steven knows this, might be a size or 2 snug. He gets attention, especially from the ladies.
Well, this day he had this picture here. He's got black pants on, but you're saying he had green pants that match that blazer?
It is a tracksuit. It is a topsies and bottomsies for Steve from Sarah Health. It's great because when he stands in his booth, like everybody's wearing, polos and whatever. And if you're born, why fit in when you're born to stand out? He stands out.
My weird clothing choice when I had the Vinicial booths was my Vinicial, like, like vintage, like t-shirt, like the t-shirt you and I are wearing, on top of a white button up, which is just so
Damn.
dorky, but
All
it
right.
was different. It was different. I was the only
Different.
one wearing
Different.
a branded t-shirt on top of a button up.
Yeah.
And it made no sense. And then the shirt comes up to here, and then the button up all the way down to my wrist. It made no
I'll
sense either. But you're trying to catch eyes, you're trying to catch attention.
I'll give a recap of that physical event. So I was at this thing called Physical Brand Triumph. Essentially, they have a franchise model where you buy in and you get a lot of these resources and branding, the whole nine. And there are 601. I did not understand this. 601 locations. I figured they were big. I just didn't do the homework. 601 locations in the US. It's large. And they bring all the franchisees or invite all the franchisees in once every 18 months to sort of like a rah-rah, like, let's get together, let's have some culture. Here's what we've done. Here's how great we've been. And then here's what's coming. And here's what we're going to be providing you with. Like, get psyched. They asked me to sort of like jump on stage and like be an MC a few times. And I ran around, did some interviews, which I'll be releasing. I either didn't miss the memo or did miss the memo, or like sometimes I don't read the syllabus. Did not expect it to be this large of an event. Like, walked in and I was expecting it to be like a room at CSM. It was like screens the size of Madison Square Garden on stage, full production company, people with headphones, and like it felt like the Oscars or the Emmys. It was legit, man. They put on an event, and they brought me up there to be like a dancing monkey. But it was legit. And then the fun part, of course, is the conversations afterwards, where you have these people who've had franchise locations, and you have to be a PT to have one, or you can be an owner, but you have to have a corresponding PT with you to go into the business. And it's interesting to watch people who have one location and they've just gone into it, or 19 locations, they've been doing it for 20 years. And I'm a fly on the wall. I get to listen to these conversations, and they talk about all the same stuff we do, the same problems, the same difficulties. Like, this is profession wide, but it was an interesting event. Have you ever been to one of those, like in the industry? Have you been to like a PT clinic or chain, like rah-rah event?
Nope.
No.
Just like the comfort, like the state ones, like APTAs or whatever.
I've done, obviously when I worked for Fox, I did Foxes, and we used to do them all across the country. We used to do little ones all across the country because we were a remote, spread out workforce. But hey, listen, big, small, they're all talking in the hallways over in happy hour. That's why the tagline of the podcast is the best conversations happen at happy hour. Welcome to ours. You guys are all talking about the same things.
Interesting stuff. I've been thinking about ways to whether it's partner or acquire out of network physical therapy practice, because I think that in network there's enough competitors. I think there's enough of these corporates. I think the physical with the franchise side. I think physical might be one of the only, or definitely the biggest franchisor. I think
it's
but unless we, like I said last episode, like unless we partner or acquire in a network practice, I prefer the self-pay or the out-of-network model better, regardless of the state. And you can potentially garner $200 a visit. So if there's any practice owners out there, if there's physical therapists out there that are interested, reach out to me. You should be able to find me somewhere on the internet, or comment below and then reach out if you want to talk. And if you have a practice, or if you have a mobile practice or brick and mortar, feel free to reach out and we can have a confidential conversation about your situation and maybe see if there's some potential partnership there.
Jerry's saying he works with a couple clinics owners that are not PTs. I believe the model is that you can be an owner, but you have to have like a PT like somewhere on the license or something. I think that's the rule. But
makes sense.
All right, parting shot. Dave, what do you got for today?
Parting shot. Today is opening day. The Phillies will beat the Nationals 7-5. That's my prediction as my parting shot.
Opening day. Everybody's in first place. This is great. We're all
if we beat the Nationals, we're in first place in the division.
Best record in the division. Yeah. It's a great way to start. Listen, man, it doesn't have to be opening day to start from zero and change what you're doing. You don't have to hate on what other teams are doing or other PTs are doing. You don't have to accuse them of fraud on LinkedIn. Bold move, Cotton. Let's see how it plays out for him. Understand what the other person is doing maybe before you take some shots at them. That's my parting shot. We'll be back on Tuesday. What do you got, Dave?
And as always, go check out PT Pintcast, Learn Medicare Billing, and the Dave Kittle Show on YouTube, iTunes, Spotify, wherever your podcast player is available.
Shout out to California. Had several people from California say they were listening to the live stream while on the treadmill. That's what they do. Some people listen to funny people. Other people listen to us yell and laugh and bitch and moan. We'll see you guys on Tuesday. We'll be